Hello, my name is Megan Slater, and this presentation will cover cytauxzoonosis and information regarding treatment and drug carriers for this disease. Cytauxzoonosis is a relatively new disease in domesticated cats that is caused by a protozoan called Cytauxzoon felis. Some of the signs that a cat may have this disease include dehydration and anorexia, anemia, high fever, jaundice, and other symptoms as a result of these. Because there are so many complications that can arise, the likelihood of survival once infected is extremely low. Humans, however, cannot be infected with cytauxzoonosis as it appears to be limited solely to the family Felidae. Researchers have determined that bobcats have become carriers of the protozoan after mild infections, but the exact cause of this organism is still unknown. Though bobcats can't become infected with the disease, a Lone Star tick called Amblyomma americanum can transmit the protozoan to either another bobcat or domesticated cats. Once inside a domesticated cat, C. felis undergoes two major stages, schizogony and merogony. Macrophage cells that are infected will clog venules in some of the major organs, like the liver, the lungs, and lymph nodes. When schizoids are numerous like this, the cat has the disease. Then schizoids become merozoites, which break out of the macrophage cells and will infect a cat's red blood cells. Although this doesn't typically cause the main symptoms, it's the way to diagnose it. Most reported cases of cytauxzoonosis in the United States are found in the southeast during the months of March through September. As you can see, this correlates to when the Lone Star ticks are primarily active. Despite previous medications being used to treat this disease, one of the most recent and potentially successful treatments is a combination of a known antibiotic drug, azithromycin, paired with an anti-malarial drug, atovaquone. Together, they have an approximate 60% survival rate, which appears to be the best chance a cat has once infected. As a macrolide, the mechanism of action for azithromycin is to prevent bacteria from growing by interfering with their ability to make proteins. Although azithromycin is fairly inexpensive, combining that with atovaquone and other medications to treat symptoms can be extremely pricey for pet owners with such a low rate of survival. Perhaps treating cats with azithromycin paired with atovaquone may have a higher survival rate if they were attached to a drug carrier. Utilizing liposomes as a drug carrier could prove useful for targeted drug delivery by going to phagocytic cells. Another reason liposomes would act as a good drug carrier is that azithromycin is a nonpolar molecule and liposomes can carry it inside their hydrophobic tails. Unfortunately, liposomes are more expensive and most likely not the best candidate to use for medication for a pet. Micelles may be a better alternative because they can be taken via oral routes like azithromycin and can transport hydrophobic molecules as well. They are also less expensive compared to liposomes. Thank you for watching my presentation. Here are some resources I used when creating this slideshow.